Zhang. Today, we're going to discuss injuries to the teeth. Your textbook, Oral Pathology for the Dental Hygienist, reviews these conditions as well, and I encourage you to read and study your textbook thoroughly. Injuries to the teeth are very common, and you will see many of these conditions as you work in the dental hygiene clinic. You may have already seen some of these before. Today, we're going to review attrition, abrasion, abfraction, erosion, fractured teeth, and a condition called meth mouth. Let's begin with attrition. Attrition is the wearing away of tooth structure during mastication or chewing. You will see this most commonly on the occlusal and incisal surfaces of the teeth, and occasionally on the proximal surfaces of the teeth. Bruxism, grinding of the teeth, will accelerate attrition. Generally, wear facets are visible on the incisive and occlusal surfaces of the teeth. If your patient no longer has mamelons on their incisors, they are exhibiting attrition. Abrasion is a pathologic wearing away of tooth structure. This is from a mechanical habit. Abrasion can occur on enamel, however, it is more common on exposed root surfaces, particularly the facial root surfaces of molar and premolar teeth. Abrasive toothpaste can cause greater abrasion, and porcelain crowns, bridges, or denture teeth often cause a great deal of abrasion on the opposing tooth structures in occlusal contact with the porcelain restorations. Habits that stress the teeth mechanically can also cause abrasion, such as opening a bobby pin using the front teeth, or holding pins between the teeth on a regular basis. This will create notches from the abraded tooth structure. In this picture, note the extensive abrasion evident on the incisive surfaces of this patient's teeth. This patient most likely had a porcelain mandibular prosthetic teeth that occluded with these maxillary teeth that caused the excessive wear that you see here. Abfraction is a term introduced in recent years. It refers to a wearing away of tooth structure that is generally found on premolars and exhibits as a wedge-shaped defect at the cervical area of the teeth. Abfraction is a theory which states that these lesions at the cervical region of the teeth, as you see here, are from forces on the teeth from continuous flexure and release. These forces occur either from mastication or bruxism. The flexure and tensile forces cause the enamel rods to weaken and break, which will lead to the lesions. We used to repair these lesions with restorations, but have found that often the continued flexion and tensile forces dislodge the restorations, whether we use composites or even glass ionomer restoration material. Not all practitioners accept this theory, and it can certainly be difficult to tell abfraction lesions from toothbrush abrasion. Note the abfraction lesions here on teeth 24 and 25. Erosion-type lesions on teeth are caused by chemical action, which causes a wearing away of tooth structure. Erosion is a huge issue at the moment, as so many people are using soda pop and energy drinks that are extremely acidic. With erosion lesions, the area of the teeth that are frequently touched by the acidic substance exhibits smooth wear areas. This photograph shows erosion lesions on the maxillary facial surfaces, more in the cervical half of the maxillary anterior teeth. When you see these types of lesions, you must figure out how that part of the tooth became eroded. This particular photo shows an erosion in an area that we do not usually see erosion. I would begin discussing with this patient whether they are sucking on lemon wedges or orange wedges. There has to be some acid exposure in that area for this to occur. Erosion from bulimia, an eating disorder in which the patient binges on food and then forces themselves to throw up, will show erosive lesions on the maxillary lingual anterior teeth. A very common finding now with the acidic drinks in our society is what we call cupping. On this photograph, note the cupping of the molar cusps. Another condition of the teeth that has become common in recent years is fractured teeth. Fracture is a fairly common chief complaint that I saw with many patients while I was a general dentist in the Air Force. Often, patients will eat hard objects such as popcorn kernels that didn't pop, etc., and then experience a tooth fracture. Sometimes the fracture does not exhibit right away, and the patient may even tell you they were eating toast or some other softer food when the fracture occurred. Other patients will have experienced trauma, such as a baseball to the face, or a fall, or some other accident that caused fracture to the teeth. These types of injuries to the teeth may require extensive care. The last condition we're going to look at today is called meth mouth. This is a condition that has come to the fore as methamphetamine abuse has increased in our society in recent years. Meth addiction is a difficult situation, and a number of factors contribute to meth mouth. Methamphetamine is a very acidic substance. This, combined with the craving for high-sugar drinks and a lack of good oral hygiene care, combines to create a devastating destruction to the patient's mouth, as you can see here. This brings us to the end of the traumatic injuries to the teeth section. Be sure to begin studying the synopsis for both Chapter 1 and 2. Chapter 2 synopsis is found on page 72 through 77. Make yourself flashcards and be sure to review using these videos and the practice slideshow to prepare for our first exam in September.